Welcome everyone to the webinar, and we're looking at accelerating access to equipment and assistive technology today. So I'm going to hand, without further ado, over to David Asquith. So David, on to you.
Thank you, James. Thanks everybody for attending the webinar today. My name is David Asquith. I'm the Partnerships Manager at DLF for the north of England, as you'll probably learn from the accent as we go on through this presentation. So I'm delighted to welcome everyone to the webinar. Thanks for all attending. I'd also particularly like to thank the speakers for giving their valuable time and effort in putting their own talks together. So it's an important title heading for this webinar, Accelerating Access to Equipment and Assistive Technology. And it's a question that's obviously something that everybody's thinking about with various issues that are happening within the profession. Local authorities, housing associations and other organisations that complete assessment face many challenges and barriers dealing with the demand for assessments. There's capacity issues and even getting equipment. I was down at the OTAC conference in Tamworth and some OTs there were telling me they were finding it difficult actually getting actual equipment for them. And of course, we're living longer, as the latest census for 2021 has evidenced. We have some excellent speakers today who are all passionate in their field of work, and I'll be introducing them a little bit later on in a few minutes. But first, let me quickly take you through who DLF are and what we do. So, accelerating access to equipment and assistive technology, that's myself, and there's an email there for anyone who wants to inquire about as we go through on this, you can do. So a little bit about DLF. We've been going over 50 years, and we first of all established as Disabled Living Foundation, but obviously we're now referred to as DLF. It's a national charity and part of Shaw Trust. We offer person-centred solutions, both for the public and professionals, providing impartial information, advice and training. I suppose really what we're all about, we're trying to keep people in their own homes and living an independent lifestyle. So changing with the times. So over the past 50 years, we've been driven to be responsive, not only to the needs of the disabled community, but to innovate by developing tools for the public, professionals and the assistive technology industry. So DLF want to enable independent living by focusing on the person beyond the disability. The general public can now access our newly redesigned Living Made Easy website with its easier layout for better navigation, leading to appropriate advice. We've spent significant amounts of money over the last few years upgrading our technology in the Living Made Easy website. The website is now mobile responsive and can be accessed by tablet, mobile phone, computer or laptop. On the website, you will find hints and tips section, along with our top picks around the latest gadgets and assistive technology, aids and minor adaptations. I suppose at this stage now, we just need to declare a self-interest because we feel that we have a tool that will assist in accelerating access to equipment and assistive technology for people. And that tool is called ASARA. It's an online guided advice program. It's a self-assessment tool and has truly come into its own on demand for assessments as assessments rise within local authorities with limited resources and restrictions around home visits, along with an ageing population. And that's not forgetting the pandemic when people had little access or no access to assessments. This has prompted local authorities to rethink how they deliver their information and assessment provision. And DLF has redesigned ASARA over the last 18 months to provide a much better seamless experience for service users and assist with statutory obligations. So ASARA, it's an online guided advice tool. It sits within our Living Made Easy platform. ASARA stands for self-assessment, rapid access. And so how does it work? Well, it's really in 3 easy steps. You just pick a topic from over 90 topics, you answer some questions, and then you receive a bespoke report. The answers and questions and answers have been written by, the answers have been written by professionals and OTs, and you have access to the report to provide information. and this helps you around issues you've identified. The report guides you through to the Living Made Easy product catalogue. Now, this has got over 10,000 products and 950 suppliers and retailers. And this gives impartiality, it gives independence to the service user. And it's the largest database of its kind in Europe. So looking at speakers today, we've got some great speakers, all passionate about what they do. And all our speakers who have a connection with a local authority have actually got an ASSARA license themselves and have been using that within the last 12 months. So I'm just going to go through where we're kicking off today. So Rachel is Rachel Russell from Foundations, and Rachel will be discussing her journey to accessing equipment, assistive technology and adaptations, and really some final thoughts to reflect on, which are quite powerful. We'll follow that by Lee Owen, and Lee's a Community Development Coordinator from Staffordshire County Council, and Lee will be discussing recent changes they have made to improve the front door service and how they've implemented ASSARA within the council. Following on from Lee with Diane Clayton, who's a Strategic Lead for Independent Living and TECS at Sefton Council, and Diane will be talking around how they've implemented ASSARA and how it will assist the council preventing needs escalating into more complex care. And following on from that with Georgina. Now, Georgina can't be with us today, but she's kindly done a pre-recording of her presentation. And if you have any questions to that event, we can actually answer those. She's willing to answer those at a later date for you. And Georgina will be discussing and incorporating an online person-centered guided advice tool and a recent licensee for the ASSARA solution. So after that, we'll be doing some question and answers. I'm now going to pass on to James, who was going to introduce Rachel for the first thing.
It's going to be a very quick handover. I'm literally just going to hand over to Rachel now. If Rachel, you'd like to come on, share and introduce yourself. Also, I have somebody's just asked about the live transcript. I hope I have turned that on for you now, hopefully. So that should be all going. All right. So Rachel, over to you.
Thank you, David. Thank you, James. Thank you for inviting me this morning. Yes, as David explained, I'm Rachel Russell. I'm the Senior Regional Advisor at Foundations. For those of you that aren't familiar with Foundation, we are the government's representative body for home improvement agencies. So I appreciate that I'm here with a bit of an adaptations hat on this morning. However, the issues that we have around access to assessment resource for adaptations are exactly the same issues that local authorities have in terms of that access to assessment resource for equipment and assistive technology. So what I want to do over the next 10 minutes is really to provide a little bit of background and context for the 3-4 other speakers that we've got this morning, and just kind of explore the issue that we have, the issues that we have around accessing equipment, accessing in a timely way that assessment resource, and then just to look at, as David mentioned, some genuine opportunities that there are in terms of that self-assessment. Okay. So in terms of just providing a little bit of background around my journey, I am an occupational therapist by background, and worked for around 18 years within local authorities in social care as a community occupational therapist. And then over the last decade, I've been involved in a number of kind of high profile projects, which has really lighted my passion around how we ensure that people get timely access to equipment and adaptations through accessing timely access to assessments. So one of the things that I've been involved with back in 2018 was the government review of the Disabled Facilities Grant. And one of the things that that report highlighted, and I'm sure this is really familiar to all of you that within local authorities, is one of the greatest delays in people accessing solutions to their health and social care needs is that access to a social care assessment. And often that social care assessment are assessments that are being carried out by occupational therapists. So that's one of the things that the DFG reviewed, was that timely access to that occupational therapy assessment that was delaying access to equipment, adaptations and assistive technology. I was then involved and am one of the lead authors with colleagues from the Housing Lynn and Marnie Walker, who's another occupational therapist. And we published with the Royal College of Occupational Therapists Adaptations Without Delay. And that was a real opportunity to use the evidence base to say, look, you know, access to occupational therapy assessment resource is challenging, and I'll talk about that in a minute. So actually, how can we use an evidence base to help local authorities think differently about how they use their occupational therapists, so that we're really making best use of the skills and knowledge of occupational therapists, which are, you know, we're needing to be using OTs for those kind of really complex cases. And then back in March of this year, we supported the Department of Levelling Up Housing and Communities at Foundations to publish the DFG guidance. And chapter 4 very much talks about how we can work collaboratively across housing, social care, front door services to create that access to equipment and adaptations. So that's a little bit of kind of my journey. The reason I'm passionate about this is that what we know in terms of the evidence base, oh sorry, I've got this slide here because this is just reminds us around actually what the issues are. What's really fantastic for occupational therapists and other allied health professionals is that given changes in legislation, so obviously the Care Act came in 2014, and that kind of modernised social care legislation. So kind of the update around legislation, government policy around discharge to assess, urgent care response model. Fantastic for allied health professionals, fantastic for occupational therapists, because our skills and knowledge in terms of the assessment part of those elements means that we're in high demand. But what we also know is in terms of the supply of occupational therapists, you'll know that there's a high number of vacancies, etc., etc. And actually, you know, that demand is outstripping the supply of assessment resource that we've got for occupational therapists. What we know and tends to happen is what we're very good at in local authorities is getting to those individuals that are at high risk and need that kind of immediate input from an occupational therapist. And what we know is it tends to be the people that end up waiting are those people who are at less risk of waiting, which tends to be those older people with low level needs. And it tends to be those individuals that end up waiting quite a significant length of time for an assessment. But what we know, although those individuals may not be at immediate risk in terms of waiting for an occupational therapist, what the evidence does tell us is it actually, those individuals that end up waiting a significant length of time for assessment end up developing their health and social care needs actually end up increasing the longer that they wait for that assessment, and ultimately that piece of equipment, adaptation, assistive technology that will help them in terms of their health and well-being. So the longer people wait, the other thing that we know is actually they end up needing much more expensive and much more complex interventions. So in my world of adaptations, we know that the longer people wait, they move from needing perhaps quite a simple adaptation to actually needing more complex adaptations. So actually, if we could get to those individuals quicker that are on those waiting lists, then obviously, you know, we kind of, in terms of the system, hopefully we save money and keep people safe and independent in their own homes for longer. And because of that evidence base, that was one of the drivers around adaptations without delay. Because we, as I say, in terms of the demand for occupational therapy, you know, it's about actually, is there a different way of thinking about that access to those assessment skills? And as I say, what we did with adaptations without delay, if you're not familiar with this, you can, I'll pop a link after I've spoken, if you've not had access to adaptations without delay. But what we did there, again, we used the evidence base to think about very differently around actually how can we make best use of that assessment resource. So what we did was we used that personalised approach to health and social care to look at, okay, who are those individuals that need that specialist knowledge from an occupational therapist to carry out that assessment? Who are those individuals who have those long-term conditions that need some skilled assessment? And then actually, you know, how can we work with those individuals where they've got general needs and actually perhaps don't need the more specialist skills of an occupational therapist? I think what we've found, obviously Adaptations Without Delay was published back in 2019, and what we've found is that local authorities have been very creative in terms of how they're dealing with those individuals with targeted needs. So those older disabled people with long-term health conditions, and this is where many local authorities, and I know DLF run the trusted assessor training, so they're using that trusted assessor model to actually work with those individuals rather than pulling the assessment resource out of the occupational therapy teams. I think where we've been less successful, or where local authorities are perhaps being less creative, is those individuals that with kind of general needs who are ringing up and kind of saying, look, you know, I'm beginning to struggle with those everyday activities. So this is what we did with Adaptations Without Delay. And as I say, although it's adaptations, it applies equally to equipment, because often within local authorities, it's the same occupational therapy teams that are doing assessments for adaptations, and it's those teams that are doing assessments for equipment. Yeah, so this comes from Adaptations Without Delay. So individuals that are in that universal layer at the bottom, in terms of complexity, it's those individuals where their condition is predictable, they're stable, they're not likely to have had a recent deterioration in health. Really key is often, you know, it's about working with individuals where actually they have a real good understanding of what their needs are. They are really good in terms of being able to communicate and actually make really good decisions about actually what is the best type of solution for them. And as I say, but it's about providing them with the tools to be able to kind of be guided to the right type of decision. So I've just put this here because it just kind of unpicks the type of people that we're kind of looking at in terms of, can we do something different to support those individuals to make really good informed decisions about the right type of solution, rather than them being embroiled in assessments perhaps with an occupational therapist or a trusted assessor. One of the things that we recommended in Adaptations Without Delay for those individuals at that universal level is, you know, let's think creatively about that assessment. So one of the things that we know in terms of the Care Act, particularly around prevention, is around, you know, it being a proportionate assessment, you know, supporting the idea around self-assessment and guided assessment, and looking at what tools there are that actually support that self-assessment, that guided assessment. And actually, I think if we take that approach, guided assessment, actually we are genuinely then, for those individuals who don't have complex needs, we're actually giving them a genuine opportunity to take control and give them choice around actually the solutions that they want, rather than kind of funneling them down through a very in-depth and sometimes very intrusive assessment from an occupational therapist. So in Adaptations Without Delay, one of the examples that we gave to local authorities around actually how could you do this differently in terms of providing that guided assessment was Ask Sarah. So I know I've whipped through that, but just some final thoughts here. You know, if we are really to value the role and skills of allied health professionals, occupational therapists in local authorities in social care, then actually we need to support them to do the job that they do and to enable them to do it well. And that's about us as the local authority ensuring that actually, you know, we're getting them to focus on those individuals where their skills are best used, rather than perhaps getting them involved in individuals with more general needs. So you know we really then value those skills because we're using those skills where they're needing to be used. I think often we pay lip service to about empowering people and giving people meaningful choice, etc., etc. But I think it is around actually doing that. And I think obviously tools such as Ask Sarah actually do empower those individuals at that universal level to, you know, really empower them to make some really good choices around equipment, adaptations, assistive technology that will actually help meet their needs. And I think that one of the values of Ask Sarah is it's not intrusive. It's obviously online, you know, the person is doing it with the computer, as it were. They're not having to go through a very intrusive assessment. So I think something like Ask Sarah really does empower people at that universal level and really does give them genuine choice and control over their lives, because it's about helping them identify solutions that actually do meet their needs. And I think we need to find sustainable solutions to the issue of accessing assessment resources. Again, I think something like that Ask Sarah that provides the opportunity for self-assessment and using artificial intelligence. You know, we, as David mentioned at the beginning, we've got an increasing ageing population, we've got a shrinking workforce, so there is only ever going to be so much human assessment resource out there. So I think what Ask Sarah does is it provides us again another tool which provides a sustainable solution to accessing that assessment resource, if that makes sense. I think the other thing as well, I think, is that we have a duty of care to everybody coming into our services, and I think, you know, we have got a, you know, a duty of care to those individuals that are waiting for assessments. So I think if there are things that we can be doing for those individuals that are coming through the front door, or perhaps, you know, using Ask Sarah provides us with an opportunity so that people don't have to come through the front door, but, you know, it provides us, you know, them with an opportunity to get an assessment rather than having to wait significant lengths of time for an assessment. So I appreciate I've whipped through that, but I'm sure if you've got any questions, if you want to post them in the chat box, I can answer them as we go along. But I know there's opportunity to ask questions at the end.
Lovely, thank you very much, Rachel. And as Rachel said, if you've got any questions at all, pop them in the chat and I will collate them. If you've got any questions and you want to actually ask them in person, so to speak, if you stay on until the end, and we'll have a question and answer session and we'll be able to do that. All right, lovely. Thank you very much, Rachel. What I'm going to do now is I'm going to pass over to Lee Owen. So Lee, I'm going to share your screen for you. Okay, and hopefully this will work for everybody. Fingers crossed anyway. Okay, Lee, it should be all yours.
Let's just have a little play of that.
So you might have to click on the screen first before you're able to move it about.
Right, okay. Yeah, let's try again.
Yeah, there we go. Lovely.
There we go. Yeah, brilliant. Okay, good morning, everybody. My name's Lee Owen. I work in Staffordshire County Council as a Community Development Coordinator. I work in public health and I work on a prevention programme called Supported Communities. What I'm here to talk to you about is mainly around ASAR and the way that we've presented it on our web pages. So going back to when I first started this work, we knew in Staffordshire that people wanted to remain independent as possible. They didn't want to come into the services unless absolutely necessary. And I think we've got a responsibility as a council to encourage that and actually enable people. And we know that sort of AT or assistive technologies solutions can help. But when we were looking for different sort of like examples of what we could do, we started gaining understanding that it needed to be the right form of AT or assistive technology for that individual. But also it's important to have that advice and guidance around that form of AT as well. Because obviously OTs can't be there all the time. But it's nice to, you know, if somebody wants to look for something themselves, that all the right information's there. So we wanted to explore different ways that we could support the people of Staffordshire to remain independent, and also try and sort of like, you've got to think about the budget of people. Obviously, different people have got different budgets, especially when you're thinking of self-purchase. And again, that information and guidance comes behind that, and that's really important. And we all know that there's all sorts of different forms of assistive technology out there, and we wanted to share this information in a way where we're also offering choice, and also where the information around the assistive technology was understandable to people. I mean, I've been on the internet and I've read stuff and it's so confusing. So we needed to be careful what sort of system we were using and things like that, and what sort of information we were putting out there. So if we just go on to the next slide, let's try that. Yeah, brilliant. Okay, thank you. And actually, I'd been using a website called Living Made Easy for a number of years, especially in my previous roles, because my previous roles were more looking at helping to keep people living independently using forms of assistive technology together with community sector services. And I found out that it was all linked, and we got this ASARI, and so started looking at the ASARI and, you know, and looking at ways that could help us. And I wanted to put that on the website so it's accessible to everybody. And what we found about ASARI was that it was a reliable sort of information and guidance around the different forms of assistive technologies that could help people with the daily living activities that they're struggling with. And even better still, it was showing you what the products look like, and obviously the different types of products that are out there. So, you know, you could look at a dressing stick, but people don't usually look for a dressing stick until they need it. But then there's different forms of dressing sticks. So, you know, it's about finding that right shape, that right length and things like that. And that's where ASAR comes in, really, in the Living Made Easy website, because it's got a massive range of products on there. And also, more importantly, it's got the pricing comparisons on there. And obviously, from a council's perspective, we need to be offering a choice of places where people can buy these products from, because we can't be seen sort of focusing on one shop, if you like, or one manufacturer. Try next slide. Thank you. Okay, so we also wanted to make it look and feel easy to use, the website I'm talking about now. So if, oh, we're jumping on. There's my contact details if you want to contact me for any questions, by the way. If
Do you want me to bring up the website for you, Lee?
Yes, please, if you don't mind.
No problem. I will do that for you now.
Great. So what we've done, we've actually designed what we called an assistive technology web page. I won't show you all the information on there, but if you can just scroll down to the house, please, James.
You should have remote control now, Lee, hopefully.
Let's just try that now. Yeah, I'll just click on that.
There we go.
Yeah, super. Okay, so this is our interactive house. So the way that you would use this interactive house is that you would think about the daily living tasks that somebody's struggling with and relate that to a room in the house. So for instance, if it's something like somebody's struggling with opening tins and jars, you would click on the kitchen. And then that would take you to the next section where it's all split up into categories. And in this case, we're looking for tin, jar and bottle openers. Click on view more. Then that will show you a full range of products that can open tins, jars and bottles. But the great thing is when you click on the actual item, say you wanted a bottle opener, it will show you the product, it will show you price and also where you could possibly buy them from, and sort of, you know, the price range on there, which is absolutely brilliant. Okay, let's just go back to the interactive house. And the other thing that we've come across was that Android devices don't like the interactive house, so that's like your tablets or your phones. So we've also put these little icons, if you like. These are like app symbols. So these relate to the rooms in the house. So you would see everything except for the house on an Android or tablet device. And this, we found this is quite useful for our social care staff when they're going out assessing people. So if they see that somebody's wants sort of, they see the need that a piece of equipment would help them, we can actually show them there and then. And then also, more importantly, we've actually got the Asara link just below there. Still not sure what items might be useful to help you. And it roughly, honestly, it takes about 2 minutes, which isn't a long time. And it's not like one of the assessments when the assessors come out to you. It's really quickly, and it'll show you all the products that can help you with any daily living activity. There is some other information on that website, but I'll let everybody have a look at that. The link's on that slide. If we could just show the last slide, please, James.
Yeah, I'll just change them over for you now.
Super duper. I do know that, I mean, again, at the end of the session, there's time for questions. But, you know, please feel free, throw me an email. Any questions, I'll get answered. I'm here for anybody that wants information and advice.
Lovely. Thank you very much, Lee.
Yes.
And again, just as Lee said, if anybody's got any questions, pop them in the chat, or you can wait until the end, and then we can actually, you can either pop them in the chat, or you can actually ask the people face to face. So I'm going to hand over now to Diane. So Diane, I'm going to share the screen for you as well. So you've got your presentation up there. And if you'd like to just introduce yourself and go from there, really.
Yeah, thanks, James. Thanks, everybody, for coming along to the webinar today. My name's Diane Clayton, and I'm the Strategic Lead for Independent Living and Technology Enabled Care for Sefton Council. So this presentation is basically to give you a summary really. We've only just launched ASARA in April, at the end of February, March. We did a launch and a walk-through kind of practice period with some of our prescribing staff teams, and then we went live to the public and the residents of Sefton. So this presentation is really just to tell you how we have what difference it's made, how we're using it, and how we can see how we're going to be developing ASARA moving forward as well. Next slide, please, James. So the background for Sefton was that we realised and we were informed that the number of people whose requests for support that are met by the provision of low-level support, such as aids, adaptations and telecare, is significantly lower than other comparators locally and regionally. And those requests made by short-term support is lower than the comparators, and those made by long-term support is higher than our local comparators. So we all know that home adaptations can prevent falls and reduce hospital admissions, and avoid the need to move into residential care, and also reduce the need for more complex and more expensive packages of care later on. So the retail market and independent builders are beginning to adapt to consumer-led changes, and local authorities need to improve and increase the provision of short-term support rather than long-term care, in line with our early help and prevention objectives to reduce the costs associated with falls, increase hospital admissions, and, as I said, leading to longer-term packages of care and potentially admissions into residential care as well. So in Sefton, we recognise the need to provide people with the right equipment, as well as encouraging residents, where possible, on a strength-based model, to access their own equipment using asset-based approaches. So we wanted to provide comprehensive and up-to-date information on the types of equipment and minor aids that were available to residents, and those that can be purchased easily and cheaply off the shelf. Therefore reducing pressures on our front door, our adult social care front door and triage team, and also to afford people the opportunity to not necessarily follow that formal assessment package. And as Rachel alluded to in her presentation, you know, the fact that there are much longer waiting lists for people who aren't needing more intense forms of care and support, and we wanted to address that. So we want to support individuals to live as independently as possible and work to prevent the needs escalating to a point of reliance on more formal complex care. Next slide, please, James. So, ASARA and Sefton, we quickly realised that there were many benefits to using ASARA as an online rapid self-assessment and guided advice tool. So it's designed to provide individuals and their families with advice and guidance, as has already been explained and discussed. It's helping us to respond to our demand management priorities, and it's helping us to maximise the use of age and adaptations, especially with technology-enabled care, and the fact that this last 2.5 years has increased the use of technology for people in all sorts of different environments. So we wanted to facilitate that access to information and guidance, and that would assist them in making the right decisions and purchasing the right own aids and equipment, and raising awareness of what is out there, what can cheaply be bought off the shelf quickly to respond to much earlier to mobility needs, for instance, and you know, low-level daily living activities. So within the first 3-month period, we anticipated that we would have at least 500 inquiries to the ASARA facility, which would equate to 2,000 inquiries per year, and 6,000 inquiries over the 3-year period that we've commissioned ASARA for. Within the first quarter, we've exceeded that number of inquiries, so by almost doubling it by 457. So the total number of inquiries made on ASARA was 957, with a further 191 in May's monthly reporting as well. Next slide, please. So this is the monthly breakdown of the inquiries that were made to ASARA, and as you can see, in the first month, all of them actually, we had at least 80%, or 75%, sorry, I should say, of new inquiries, and a number, you know, 19% to 24% of repeat inquiries to Ask Sarah, which is really good in terms of the awareness and the knowledge that people have of this service provision. Next slide, please. So we've broken this down in terms of the different topics of inquiry from those calls and from those hits. And we took the top, the top inquiries there. And obviously we can see that the main ones about inquiries around bathroom safety, using the shower, standing and sitting from the toilet, preparing food, and quite a lot about people wanting assistance and support, equipment that would help them to get out and about. Opening jars and bottles and tins and packages, obviously we had some calls about that, but in the main we can now pull off those themes and look at how we're going to develop our technology enabled care offer within Sefton. What equipment do we need to be focusing on to respond to our residents' needs? And that will help us to expand our telecare provision as well. So it's been really, really useful in trying to analyse and scope with suppliers where we want to move forward. And this is going to be happening on a quarterly basis, where those topics for inquiry will be compared as well. Next slide. So more benefits from using Ask Sarah was it's also helped to facilitate information, and we can add to this. We can add to Ask Sarah with content as well. So obviously, we're aware of people's budgets and financial situations. So we wanted to offer information around financial support, around personal budgets, how they can be used, and how to apply for direct payment grants as well. In many cases, Ask Sarah is much quicker than the formal assessment processes, offering people a wider range of choice and knowledge of what equipment's available. And it offers an informal assessment with a range of questions that are very bespoke to the individual, and it offers a really good personalised report that the individual can keep, download, and if it's advised, or if they feel that a more formal referral assessment might be required, they can attach this form to their referral. And this helps to reduce the time taken by professionals to identify and locate equipment from information contained within the report. Ask Sarah also helps professionals they can go on search, to offer that consideration of technology-enabled care, minor aids that might prevent more formal assessment. And this is working really well. It's helping to change the culture within our prescribing teams in terms of the first question that they should be asking themselves now is, have we considered technology-enabled care before we go any further? We are presenting Ask Sarah to our teams as well. Really good feedback so far. They find it quick and easy to look things up, and also to be able to get some kind of price range as well, that they can have discussions with the people that they're supporting, and it helps to structure guided conversation as well. Next slide, please. Oh, I'm sorry, I forgot to mention there, we're also developing a technology-enabled care e-learning module in collaboration with our 9 other partner local authorities. And as part of that, we have a resource section. So Ask Sarah's in there as well, which was really useful to be able to spread that. So everybody, we're hoping the main aim there is that every member of staff will have that baseline knowledge of technology-enabled care solutions across the region. We're hoping to launch that in September. So next slide, please, James. So the financial implications were also very important. And according to Sefton Council, the Adult Social Care Dashboard, in Q3 of 2020 to 2021, 25% of contacts received information, advice and signposting, which equates to 3,539 contacts. So Ask Sarah supports our front door, as I said before, to enable assistance for residents and to signposting towards Ask Sarah, so that they can look at their own self-directed care solutions as well. So approximately 15,000 contacts are received per year at our front door requesting support. Ask Sarah again helps signpost and reduce the volume of requests, reducing demand and pressures on our OT and triage systems for more complex care packages. And it also helps to delay referrals as well for more expensive alternative provision. Ask Sarah supports increased independence at home, and we've commissioned Ask Sarah for 2 years with an option to extend year on year, which is working really well at the moment. And we anticipate that this facility will also help to reduce admissions into hospital in line with our falls prevention strategy and intermediate care models, by using an asset-based model to further our overall approach. As we see a continued reduction in permanent residential admissions of 17.8 in Q3 of 2020 to 2021, SARA has helped to contribute to our alternative offer to support independent living. And according to ADAS data, we're still above the regional averages for admissions into long-term support. Next slide. So it's about joining the dots and what are our additional links. We're using SARA as a platform to raise awareness about minor aids and tech solutions that can be easily accessed by individuals. Yeah, as you know, we've also added further content onto this facility, such as a newly piloted Orca app library suite, which offers members of the public low-level support via apps. So, for instance, if you wanted to look at giving up smoking, you could go onto that app as well, and it would give you a peer-reviewed app. So it sorts out the best ones from the worst ones and offers that to our residents as well. That's just one example. There's a whole suite of health and wellbeing topics in that one. We've also linked it into our Sefton in Mind mental health directory as well, and it's also on our adult social care portal, which also it prompts staff to ask them, who have you signposted to? Have you signposted to SARA? And have you considered other alternatives before making a more formal referral? We've also got a lot of other community service providers that we are engaged with, and that if they've got any community news or any items that they would like to be promoted, we can then look at using some of our spare tabs on our SARA page to promote, and that might be going on our, for instance, our themes and our topic areas. We might promote a certain item of equipment on a monthly basis, so item of the month type of thing. We've also ensured that the information for SARA is available and accessible with links to our TECS webpage and our TECS strategy and other associated documents. And we've also provided information and guidance about the Disabled Facilities Grants and also the Foundation's webpage, Adapt My Home, which is very similar to SARA, but it's for the larger adaptations, the bathroom extensions, the stair lifts and things like that. And basically what a person would do is type in their postcode, it would take them to their own local authority, and then it would take them through to how could they apply for a Disabled Facilities Grant and what the process would be to progress and a larger adaptation. So we'll also use our monthly reporting and performance data from SARA to identify from inquiries the products and feature information, as I've just said, on a month-by-month basis. And through internal training and learning resources and guidance, we're promoting SARA with our staff and external partner agencies and community providers. We've got ongoing service development with regards to our community equipment and telecare service provision, and they'll be influenced by our inquiry topics and themes moving forward in terms of what we as a council purchase and how we can expand our digital offer, moving forward as well. And I think, yeah, so our expected outcomes, this is my final page now. Our expected outcomes are, we want to see reductions in falls, we want to meet our early help objectives and preventative objectives as well in terms of early help and prevention. We want to hopefully contribute to the reduction in hospital admissions and repeat admissions, and we want to increase independence at home. We want to improve better health outcomes, and that will come often with, offering minor aids, adaptations and equipment to people in their homes. And we want to improve home safety and security as well, with improved living environments for vulnerable residents. We want to hopefully, SARA would hopefully reduce isolation by linking people to other provisions that we have within the council and across the community. And also we want to improve our connectivity and increased use of technology-enabled care solutions. So that's my presentation. I'm open to answer any questions at the end of this session, and I'll certainly send my contact details and anything else that anyone would like as well. Thank you.
Lovely. Thank you very much, Diane. Sorry for the interruption in the middle of that one. So thank you very much. What we're going to do now is I'm going to hand over to Gina Walton. So Gina is the Senior Project Manager at Kent County Council. Now, she can't be here today, unfortunately. So what she did is she took some time with us last week, and we recorded her session previously. So hopefully this will work and everybody will be able to hear. But if David, Diane, if you can just give me a thumbs up if the video is, when it is on, that it's actually working, you can hear it, that would be really helpful. So I'm hopefully going to share my screen now, and fingers crossed this will all work. Okay, so like I said, Gina will be looking, I'm hoping she's going to introduce herself. I can't remember whether she did or not, but she's looking at discussing the strategy that they've got for approach from the council in choosing and incorporating an online person-centered guide, guided advice tool, which is obviously what we're looking at is our Sarah. Okay, so fingers crossed everyone will be able to hear this when I start it.
Good morning, I'm Gina Walton. I'm from Kent County Council Adult Social Care. I'm Senior Project Manager within our Innovation Delivery team. Sadly, I can't be with you today, but I was really keen to share our experience in Kent around implementing our SARA and how we've integrated it within our system. So I was keen to do a recording for you. And hopefully it's a very sunny day today during the webinar, as it is when I've recorded this. So I just wanted to share with you the journey in Kent and why our SARA has been quite key in delivering our vision around technology. Making a difference every day is an approach that is our strategy for adult social care, which is a new strategy and will be shortly released and start to be implemented. The strategy focuses on 3 key areas: practice, that we embed a strength-based approach to ensure that the individual is at the heart of what we do and to support them to make the best life choices. Innovation, so that we embrace change with an open mindset, invest in developing a learning culture and constantly seeking out new ways to improve how we work. Innovation doesn't always just include digital, it's about how we work in a more innovative way, but technology and digital is part of that. And then meaningful measures, which is how we ensure that we use data to inform our decisions. And digital is key within everything that we do. So that's our vision for adult social care, and particularly around the element of digital, which is where I lead. Within the team, the Innovation Delivery team, I tend to lead a portfolio of work that focuses more around technology and digital. We identified about a year ago some key priority areas that we wanted to develop. One was our digital front door, so that the information when people came to Kent Council was very clear, and that people were supported to be able to connect with other services, but we're also clear about the experience that they would receive from social care, and that improving the initial interaction with adult social care and ensure that we provide the right information at the right time. Developing our technology-enabled care offer, developing our internal adult social care system, which is Mosaic, and then looking at our data strategy, because data is key in everything that we do, and we want to best utilise that data to inform our decisions, but also our commissioning, and at an individual level in terms of supporting people. For us, our SARA fits into the digital front door and the technology-enabled care, which are 2 key areas of our priorities. So this here sets out how that comes together in terms of our vision for the digital front door. So over a year ago, we identified those priority areas, and then we started to set out what our digital front door would look like. We realised that we needed to have clear information, advice and guidance, and this was procured through Kent Connect support, which is a microsite that sits beneath our kent.gov website, but provides far more information and engaging way that people can go on and find out about the support that there's available to them, but also connect with services through a range of directories, but also clear, engaging communication. For us, our SARA was quite a key tool to have as part of that digital front door, so that people that were coming to having that initial interaction with us were able to access information, understand what support they may need and what's available to them before they start to come through into adult social care for an assessment. We were really keen to have information at the very beginning through our digital front door, so that people were able to make informed choices, connect with services, understand their what their needs are, understand if they're eligible for social care, but also to then be able to access information and connect with services. And to say, our SAR was quite a key tool for us to have as part of that digital front door to enable people to connect to the right support and services that meet their needs, which may not be necessarily through adult social care and health, and will allow people to access the support that they need in a timely way. So Ask Sarah and the Connect Support platform were key in developing our digital front door, and I'm pleased to say that as of the end of last year, those tools were put in place and are now regularly being used. We work in partnership with health, district councils, borough councils and communities to look at raising the awareness of our digital front door so that people are able to utilise these tools, but also our internal workforce so that they understand these tools that are available, and when working with people they're able to signpost and connect to these tools. Ask Sarah for us, we are regularly using, accessing analytics from Ask Sarah to understand the usage, and we have continuous improvement cycles where we look at that data and look at where improvements could be made and where we need to better promote the platform for people to use. And we continue to work in partnership with our health services, communities and also our internal workforce to look at the impact of Ask Sarah and where we need to make those improvements. The platform, the digital front door then leads into a range of self-serve solutions that we're also developing, which includes care needs assessment, financial assessment and care and support planning. But for us, it was absolutely key that we got our digital front door right so that people were able to access the right information at the right time. So our SARA was key in terms of that digital front door, but then links in very nicely to our vision around technology-enabled care. Technology-enabled care is the future. Provides digital solutions which provide people with choice and control and empowers them to live their lives. We have at the moment fairly traditional offer in place in Kent around technology, including telecare, and we are now developing a future offer and looking at what that future offer would look like. Our vision statement for this is to enable people to improve and maintain their independence for as long as possible in an environment that they are in, empower people and enable them to have greater choice and control, integral part of the care pathway and a tool for the workforce to support people, and to ensure that digital is considered for all when it comes to meeting identified outcomes for the person. So as I say, Ask Sarah is absolutely key to be part of our digital front door so that people are able to get the information at the right time. But it's also key in terms of our vision around technology-enabled care and a key tool that we're able to use in terms of our workforce, but also for people that want to be empowered, particularly for people that are self-funders, so private pay. We're able to connect them with the platform so that they're able to look at what options are available and how they can best be supported. But also our workforce are able to utilise the Ask Sarah platform when working with people to look at what's available to support them in achieving their care and support needs, their assessed care and support needs. We're doing quite a lot of work at the moment with our practitioners, our workforce, to help them understand what tools are available to them that they can use within care and support planning, our SARA being one of those, what the benefits of that platform is, but then also how they bring that into the work that they do and how they use that to work with people that draw on care and support. For us, there's some key principles around our vision for technology-enabled care. The first is that digital is first, which means that approaching any opportunity to support the person with the assumption that advice, guidance or support provided should be as digital as possible. So again, that's quite key for us by our SARA as part of our digital front door so that people can explore that as one of the first options around supporting them to live independently. And then secondly, that everyone can access technology-enabled care. So what this means is that people will be able to access technology-enabled care through information, advice and guidance, which is, again, why it's absolutely key that this sits as part of our digital front door and that we're able to signpost people and connect them to the right services and solutions. And that following Care Act assessments where appropriate, that people are able to access technology-enabled care using direct payments or through private pay. So as you can see, for us, Ask Zara sits very much across two key priority areas, which is our digital front door and technology enabled care, so that people get the right information at the right time when coming into social care, and that they are aware of what options are available to support them to live independently. And that includes people that are private pay, but also around our vision in technology enabled care, and that we're able to provide information around what solutions are available to support people. And that really underpins our technology enabled care vision for the future. As I say, I'm really sorry that I've not been able to join you today, and I hope that the webinar is really informative. This is just an overview of where and how our SARA fits in with our priorities. We are now kind of a year into our journey, and we're still learning and very much taking our workforce through the culture and learning with us, but also people that draw on care and support. And it's really important for us to be working co-production to understand how these solutions work for people and how we can make improvements together. But also using the data that comes out from the RSAR platforms, the analytics, and using those analytics to look at where continuous improvement can be made, and ensuring that people are accessing that platform, but also that people are able to connect and access the right solutions for them. So we're on a journey and we're still learning, and hopefully this has given you insight into our journey so far and some things for you to think about. Really happy for questions to be put through to me after the webinar, and I hope you have a really good session. Thank you.
Okay, my thanks to Gina. Like she said during the end of that, she was more than happy if anybody wants to ask any questions, you're more than welcome to put them in the chat again now. What I'm going to do in a second is we're just going to bring in all of the people who have spoken today, and also Janet Seward as well from the DLF. We're going to take any questions. Now, if you would like to ask any questions, you know, like on a face-to-face, actually unmute yourself, then if you could either use the reactions and put your hand up, and I will find you, and I will come to you, don't worry. But we have had a few questions come in on private sort of chat during the webinar. So what I'm going to do is I'm going to ask Rachel, Diane, Lee, David and Janet if you could just all kind of be ready for this, and we'll kind of ask some questions. So the first one that's come in, it was quite a, you know, I think it's a very good question, is do the panel think that there's been permanent changes to how they approach assessments because of COVID-19 and the whole pandemic as a whole? I'm going to kind of open the floor rather than pick on anyone. So if anybody wants to kind of, Rachel, I've got you to see a hand up. That's fantastic. If I go to you first.
Yeah, I'm just, because I might have more of a national, because of my role, I probably might have a more national feel. I think in certain local authorities, they have been really good in adopting some of the remote ways of working. So remote assessments using technology. But I think a lot of local authorities have reverted back to pre-COVID ways of working and doing face-to-face assessments. So what I would say is, I think, yes, COVID has changed certain practices, but in a lot of areas they have kind of gone back to the old more kind of face-to-face assessments. So I think it's a mixed picture is our experience at Foundations.
Thank you very much, Rachel. Has anybody got anything that they would like to add to that?
I think it depends on our teams as well. For instance, our mental health teams have very much embraced the remote assessments and using laptops and tablets on visits. I think we're in change at the moment in terms of we are realising the use of digital to complete assessments, and we're walking through that at the moment. Certainly before COVID, the door was slightly ajar onto digital technology, and it's now been kicked wide open. So there's a lot of things we've developed in Sefton. We've developed our digital strategy, and the technology enabled care strategy responds to one of the themes: empowering communities, empowering residents. That theme within it, but I think local authorities are at different paces at the moment. Some are better than others, but we are all recognising that we have to move forward with digital in everything. We've got to incorporate it and embrace it as far as we can. and in terms of cost savings and things like that, which is always the top of the any local authority agenda, it's really important. And that goes hand in hand with the you know, the changes that are being made with health and social care now in terms of that integration that's taking place, and the development of ICPs, integrated commissioning partnerships and things like that. So it's happening, but I don't know whether it's happening as quickly as maybe people anticipated.
Brilliant. Thank you very much to both. I'm going to go, there is not going to be a general theme of questions just because they're coming in. So I'm just going to do them as they come in. So the next one is straight to Rachel. So would Rachel be able to comment on what she would see as the main challenges for OTs in trying to assess the whole person and not just the immediate need?
I think this, well, it's always challenging, isn't there? Because it's whether you go in and do that where you're just focusing on the issue. I think once again, it's about giving choice and control to the individual around, you know, that we can look broader at your issues. Or do you want me just to focus on that one issue? I think sometimes you've got to be careful as well, because I think sometimes we perhaps aren't aware of the danger of over-assessing. So if you've got somebody that has just identified one issue, and there is some evidence to kind of support this, is actually if you then begin to raise other issues that you think might be an issue, it's around what that does to people's confidence. I think it's about getting a balance. And when you do an assessment, you kind of get a feel. Sorry, I'm probably not answering that very well, but basically I think you've got to be careful about over-assessing and the advantages, and there are disadvantages to over-assessing, because it's around the kind of impact that you have where somebody, you know, is feeling very confident about what they're doing, and if you then highlight a load of whole other issues that the person doesn't see, it's about what that impact might have. But you've got to balance that in terms of risk, obviously.
Thank you very much, Rachel. I will go on to the next question. So how does our SARA reduce delays in getting adaptations to clients? And I'm going to, again, open it up to anyone who wants to answer that.
In terms of, well, I'll have a go at that. In terms of increasing adaptations, it's for minor, Ask SARA particularly is for minor aids and equipment, not necessarily adaptations. However, when somebody has completed the personalised report, and it may be that it's advised that maybe they need to go for a more formal assessment, that would be that report could then be attached. That's what we're doing in Sefton, and we're encouraging people, if they want to make the referral, and they have that downloaded report that they can send as well to the OT team. So that does give the OT team more of a head start in terms of going, okay, well, they've got this, they've had that. But obviously more formally we need to make, and that would depend on them going out and assessing the home as well. So I think it speeds up the waiting time in terms of speeding up the adaptations. That would be down to the local authority processes, and also how quickly they've got contractors. I know, for instance, in Sefton at the moment, we're really struggling with our home improvements team to access contractors on a steadier basis. So we're looking at getting a contractor list, developing a contractor list that's agreed. But given the fact that contractors are extremely busy at the moment due to people obviously coming out of the last 2 years, looking around their homes probably in a little bit more detail, etc., and all the new improvements to homes in terms of decorating and DIY, etc., etc. It's been, we've noticed the pressure and noticed the demand and the delays that it's taken for contractors to agree with us. So we are looking at getting an agreed contractor list where we can go from one contractor. If they can't do it, we've got another one on hand. I don't know how it is for other local authorities, but there are pressures in terms of accessing contractors.
Thank you, Diane. Janet, did you want to add anything there?
Yeah, so just to really talk about the other side of things in terms of what we see from the charities' point of view, we see that around 2/3 of the people using Ask SARA are looking on behalf of somebody else. And when we look at who they're looking on behalf of, the number one cohort is people looking on behalf of parents, and then looking on behalf of a spouse, and so on. And so we have that breakdown. What we also know is that there's quite a degree of interest from those people in getting something, and getting something now. You know, they're reacting to a situation, and they're keen to just sort something out. And many of them are quite happy to pay privately if they have the advice that they need in order to make that safe selection of equipment. So although ASARA produces a warning if somebody has complex needs that they should seek a formal assessment, we still provide them with the advice about those adaptations and so on, because we know that some people will just not wait, and they will want to just get on and purchase something for themselves. There is a thriving private market for, you know, many of the major adaptations, and therefore, you know, really it's about reducing risk from our point of view. It's about reducing the risk of people choosing the wrong thing, and providing them with that guidance written by OTs to help them make a safer selection in terms of the product choice that they make. So I guess what I'm saying is, you know, some people are just feeling that sense of urgency to just get something, and perhaps get something for their parent, and, you know, just improve their lives as quickly as they can. And so from that point of view, there is that other pathway there that we're supporting equally with what we're doing with this service.
Thank you, Janet. I'll move on, try and get through as many questions as we can today. Like I said, if you've asked a question and we don't answer it, what we will try and do is get an answer for you, and then when we send out the link for the recording, we'll send any questions and answers out with that as well. But I'm going to, like I say, I'll stop talking and try and get some more information over to you. So one question that's come in: does ASARA link in with local authority databases to upload assessments?
I think that's probably a question for me, because it's a general question about how it works from a systems point of view. So it's an anonymous tool. People don't need a login. And one of the reasons for that is that it encourages people to use it. And as you know, as the speakers have said, what it does is it produces a report which can be saved, it can be emailed, it can be printed. But in terms of that, it's really up to the individual to decide if they want to engage with the local authority in their area. If they do, then obviously they can share that report, but it's left with them to decide whether to do that or not. We do know that when they do share it, it does cut down the time needed to really, you know, help with the assessment and understand, because some of those questions have already been thought about and studied, and the person has already, you know, come to a conclusion about some of those issues. So no, there's no automatic sharing at all. It's an anonymous service, and you know, and if people do choose to share that report, they can, but there's no data sharing, and we don't capture anyone's personal data either. So in the reports that we produce, it's all aggregated data, looking at trends and so on.
Thank you, Janet. Lee, one question that's coming for you just about Adapt My Home. So how accurate is the DFG screening tool on Adapt My Home? Could it be used as a fairly accurate guide if it says that someone isn't eligible?
I think that's a question for me. I'm not quite sure. So
Sorry.
Yeah, it's all right. It's all right. Alex, I don't know if you're talking about the self-assessment or the means test calculator. If it's the means test calculator, it doesn't ask all the questions that are in the test of resources that you would do, but it asks key questions. So it will give most people an indication of whether they would have an assessed contribution to make towards the DFG. And often it is the assessed contribution that will kind of puts people off applying for the disabled facilities grant. So if it's regarding the means test calculator, it should give most people an indication of what contribution they might have to make. But Alex, I'll put my email address in the chat box, and then you can contact me afterwards, and I can have a chat with you.
Thank you very much. Yes, it was the means test calculator that they were after.
All right,
yeah.
lovely. Yeah.
Well done. Okay, lovely. A couple more then before we finish. As the public start to return to visiting hospitals, GP surgeries, libraries and so on, what ideas and plans do the panel have about signposting advice in these hubs? That's an interesting question.
I can answer this one. I've got one I can answer. Brill. Okay, so over in Staffordshire, as part of the Public Health Supportive Communities programme, it's all about prevention, and we have realised that not everybody has actually gone digital. You know, not everybody is friendly with the internet and things like that. So over in Staffordshire, we're in the middle of developing something called community help points. And what we've actually done, we've created these help points in local libraries, one-stop shops, community hubs, and it's actually where people recognise where they can go for any sort of information. So we're working with these hubs in many different ways, and in Staffordshire we've created something called the Box of Tricks. We are looking to implement a bag of tricks in these hubs. And they're actually examples of items of assistive technology, like dressing sticks, grabbers and things like that people can look at and feel, and you know, and they can advise where to buy them from. But more importantly, the library staff or the one-stop shop staff or the hub staff can actually go on the computer for the individual, and actually go online and do the ASARA assessment tool, or in our case, if they roughly know what they want, they just don't know what it is, they can just go straight onto the interactive house and look for it.
Lovely, thank you very much.
That answers your question. Okay.
I'm just going to quickly try and get through another couple before we finish. So, Janet, it's probably going to go to you. So if a council wanted to put in place an ASARA programme targeted at the front door of their services, how long will it take for this to become embedded and established? So
I think there's probably two answers to that question. In terms of actually getting an ASARA up and running, a typical timescale would probably be between about 10 and 12 weeks. Once it's launched, then I think that sounds like it's also asking about how long does it take for ASARA to become sort of known about within the operational side of, you know, the front door and so on. And the answer to that is it can take quite a long time. I work on a project in Scotland with the EquipView partnership involving ASARA, and we've been looking to sort of raise awareness of it within the partnership partners, and I would say it's probably taken us a good 2 years to, you know, to reach all of the different teams involved in that extended region, to make sure that they know about it and rely on it and start to include it within their service delivery pathways. So probably getting on for a couple of years is quite typical in terms of reaching the public, but also making sure that all the teams internally know about it and are relying on using it on a day-to-day basis.
I'd agree with you there, Janet, absolutely. I mean, I know we're kind of just coming out into our sort of second quarter, and as much as the awareness raising that we've done, and also in the last presentation, you know, they're 2 years on and they're still learning. There's so much that you can add to, and you know, it's you make it your own as a local authority, and it's how proactive you are in terms of raising that awareness as well. But yeah, I think it's ongoing, isn't it, Janet, really?
Thank you very much. I'm very mindful of the time, so I'm literally just going to go through one last question and then I think we'll finish. So just wanted to say thank you very much to all the speakers today. Thank you very much. I really appreciate your time, and obviously everybody that's attended as well. Like I say, we will be sending out a recording of this hopefully on Monday, so just look out for that in your emails. But the last question I'm going to just go through is what is the general experience of ASARA in terms of advising a formal OT assessment? We're experiencing that most reports recommend an OT assessment, and as such, the user makes a referral for face-to-face assessment rather than purchase themselves. If that makes sense. How do we feel about that?
I mean, I'll attempt to try this one, James. Try and answer this. But our experience, we don't see that. It's in terms of a formal assessment to review. If there are some things that come out in the questioning that they may need a more formal review, it will direct the customer to that. But as a theme, what we've come across within this talk, with all the talks, and one of the themes that comes across is that people are independent. They like the choice, they like the control, and people wanting to remain as independent as possible and don't necessarily want to go through a formal assessment. And that backs up our statistics, if you like, from various councils throughout the country, that people really, they're using ASARA to look for an aid or a minor adaptation that could change the lifestyle, could change the life, and it's very highly effective and will meet their needs. So, you know, we don't, from my point of view, with the statistics that we get, those that have a more serious issue, yes, they do go through and seek that advice from a local authority, but for the vast majority, they're seeking something like a minor adaptation or a small aid to help their lifestyle.
Lovely, thank you very much, David. Right, I think we will end it there just because we have kind of run over slightly, but I really appreciate all the people that have asked questions. It's really helpful. What I'm going to say now is just if all the speakers could just stay online, and we'll have a bit of a wash up afterwards, and just to thank you for your time. But everyone else, thank you very much for your time. And yeah, if you have any questions, then you're more than welcome to send them over to our email address, which is professionals@dlf.org.uk. Send it over and we can always get some answers for you. All right. So thank you very much. And yeah, we will hopefully see you at a webinar in the future.